Welcome back to SIROWORLD 2016. I'm David Temple with three fine gentlemen that know all the world about sleep apnea. We're talking with Kent Moore, Scott Pope, and...
Well, I don't have a name anymore?
No, you know what happens? This is Tarun, but we always go... T-Bone.
T-Bone.
But yesterday, I got stuck in my head, and I went, Mr. T.
Mr. T.
And then it became...
Well, I'll go with Mr. T.
Whatever.
I pity the fool.
Pity the fool. Anyway.
Pity the fool.
Or Dr. T-Bone.
Dr. T. I'll
Yeah,
go with
Dr.
anything.
T-Bone.
All those names are better than what my wife calls me.
I don't want to know.
Okay, well, I'm just saying, if we go there.
We're going to get to the statistics about the size of sleep apnea in the world today, but how about we start with unlocking new business?
Okay.
And we'll start with you.
So, I think ultimately what we're looking at and is we're all looking for ways to grow our practice. Scott, I know you're a dentist. Kent, I know you're own a practice as well. Is we're looking for new ways to grow our practice. And the challenges of insurance, the challenge of all those things that we're facing is we're looking at ways that we can grow our business and ultimately without having to necessarily go out and get new patients and new all those, because the cost of acquisition is high, correct?
Correct.
So ultimately what I've looked at, and honestly as a sufferer of sleep apnea myself, is I've looked at sleep apnea as a way to grow my business. And what I know is that roughly, and Kent, we'll let you speak to the numbers a little bit more, is 1 in 15 patients have sleep apnea. So if we look at the average practice sees roughly 30 adults a day. So we know that 2 patients per day have sleep apnea. And what we also know, roughly 80% of patients are undiagnosed with sleep apnea. And if we look at the average practices working 200 days a year, that means that we have approximately 400 patients in our practice already that have sleep apnea that are, and 80% of which are undiagnosed. And then what's even better is that we know the vast majority of our patients are seeing their dentist way more often and regularly than they're seeing their physicians.
Yeah. The latest numbers from the American Academy of Sleep Medicine show, from public health perspective, about 30 million people suffer from this condition. 30 million.
Wow.
If you take, and that's the U.S. adult population, if you will. The U.S. adult population being about 245 million, the total population being over 300 million. 30 million people. That's a pretty sizable number. Almost a third of those snore at some point in their life. So snoring is on this continuum of airway narrowing, and so it's a sizable number of folks out there who are on some kind of continuum of airway narrowing that need to be at least evaluated and managed.
Well, from your point there, I know that of that number of, say, 30 million people that are undiagnosed with sleep apnea, only 9% are actually have been diagnosed and have seeked treatment. So there's a huge opportunity there, and I really think in dentistry, that's the next big focus or trend that we need to put our energy toward, is helping these patients that have sleep apnea and may not even know it.
And what's more amazing is that number is a little misleading, Scott, because we know 9% have been diagnosed, and what we do know is most of those people have been given CPAPs, and we know the CPAP failure rate is astronomically high.
Yes.
So even though they've been diagnosed, they're not really being treated for sleep apnea.
That's a really important point. I mean, if you've got a CPAP at your bedside, you're not using it, it's not doing any good.
What's the point? I mean, you might as well be undiagnosed at that point.
Yeah, so being able to provide patients with an alternative treatment is really kind of key, and that's what the dental profession really has to offer, and particularly what Sirona and their technology really is a wonderful complement and adds a great ability for the dentist to really make a big impact, I think.
And I think the biggest thing that we see, David, as a consumer yourself is the dentists always come up to us and say, well, how do I get started? How do I benefit from this? Right. And they always have this question, how do I get diagnosed? How does insurance fit into it? And I always say the first step in any of these processes, you've got to create awareness. And that's where this technology really shines, is that ability to create awareness in our practices. Absolutely. And that's where you can use the CCAT Air software, and that's where we can look at the airway, we can do volumetric segmentation, we can see how much airway they have, we can show them a color rendering, and that's a visual representation. So Scott, why don't you tell us, how are you using that in your practice?
I'll tell you, it's technology that both CEREC and CAD/CAM and cone beam imaging, to be able to have that in your practice and start that conversation with your patient, I think is tremendous. Because like you mentioned, we see our patients twice a year. We should be starting those conversations with those patients that we think may have sleep apnea right from the get-go. So being able to have cone beam imaging in your practice, being able to evaluate airways, being able to have that discussion with that patient that may have never even known that they've had obstructive sleep apnea, and then to be able to treat. I mean, that's the most wonderful thing I found having CAD/CAM with CEREC and cone beam imaging is with the patient, I can basically walk them through a very easy and simple workflow from start to treatment and have that patient in an appliance very quickly if they've already been diagnosed with sleep apnea.
The other thought I had is just that we currently can't predict who's going to respond in oral appliance, at least with the cone beam technology, but that's going to change down the road. There will be new technologies coming.
There'll be more science.
There'll be more science applied to it, and there's going to be new technology applied as well. But ultimately down the road, we're going to be able to predict response to therapy based upon a variety of factors. And it's going to be variable in terms of age, gender, body mass index, neck circumference, ethnicity, all kinds of variables play into it.
Well, I've got a question. I don't know if it's a silly question or not, but I wonder, why don't we hear more about this in everyday commercials? It seems like every time we turn around, there's
because there's no drug to treat it.
Bingo.
Quite honestly, if you think about it, and Kent, I want you to confirm this, is there are almost nearly as many sleep apneics as there are diabetics.
Wow.
And you tell me what day goes by that you don't see a diabetic commercial on TV because there are drugs that treat diabetes.
That's a great point. It's actually more than both asthma, almost as much as asthma and diabetes combined, but not quite, okay? But it's a large number of folks.
And if you don't mind, I'd like to add one more point onto what you're talking about. I think as you're talking about this workflow, I think one of the unique things that we have is creating predictable treatment outcomes.
Yes.
So when you combine the CEREC data with the cone beam data allows us to see the joint. Okay, now we can predictably see joint. We can predict whether our patients are good candidates for appliance therapy, what potential joint therapy issues we may have, whether or not we need to move them farther forward, less farther forward, if we're putting the joints in the proper position. So that plays a big role in potential complications that we may have.
Well, and along that same line, I've seen a number of patients that come in that suffer from sleep apnea, have been diagnosed
with TMJ.
Exactly, TMJ. And one thing we've noticed or seen in our practice is when you treat the sleep apnea, at the same time you're treating that bruxism. And we've seen bruxism come down and be reduced because of the treatment we've been able to apply to the obstructive sleep apnea.
There are some alternative technologies out there that can be incorporated in with our ability to image that in fact may act to predict a response to treatment. There's some exciting technologies by another company out there that if we can combine it with our cone beam technology, or actually CEREC is the way I'm using it, with the Zephyr technology, to be able to titrate a patient's airway within the sleep lab prior to it, take that matrix tray, cut it back, do a CEREC scan with that device in place. It's beneficial.
Yeah.
Well, then we got the ideal treatment position.
It's ideal. It's ideal.
And last thing, I feel, ultimately as a dentist, okay, what we look at is how do we get our patients to pay for this? And what I would say to dental practitioners that look in this technology, for the first time, we have the ability to help change patients' lives. Okay, we can help them get off medications that they're on, because once we help them sleep better, we get their body more regulated, and then we can look to medical insurance to help pay for this, because this is a truly medical condition. Medical insurance does help. It'll help our patients pay for treatment, and it really does grow our practice.
Yep.
Nice.
I agree.
Wow. Impassioned, informative. Guys, you are awesome. Thank you for stopping by and spending some time with us talking about sleep apnea.
David, thank you.
David.
Thanks, David.
Short break once again, and back with more SIROWORLD 2016 in just a moment.